Good morning. Welcome to Active Aging with Barb. My name is Barb Eisenberg. I'm a physical therapist assistant and also a licensed massage therapist. I work with the team at Therapy at Home, where our passion is to inspire seniors like you to live happier, healthier lives so that you can age successfully and independently with a positive attitude. Together, we can create possibilities as we get older and better. So this March is National Multiple Sclerosis Awareness Month. So I'll talk for about 5 minutes about multiple sclerosis. I've been practicing so I can say it correctly. And that includes, it's a disease that affects the brain, the spinal cord, and also the optic nerve. So I'll talk a little bit about that, and then we'll spend about 25 minutes with an exercise program to lengthen and strengthen as many muscles and joints as possible. So, multiple sclerosis, why should we be aware of it? Why should we talk about it? It affects about 2.5 million people worldwide, and in America, it affects about 1 million people. About 1 million people have been diagnosed with MS. And as I said, it affects the brain, the spinal cord, and the optic nerve. Now, the information I'm presenting today is for educational purposes only. Remember that. It's not meant to diagnose a specific condition or treat any ailment. If you have questions about your own body, make sure you check with your healthcare provider. So MS can affect almost anyone, but it's more prevalent in women, and it's most often seen in Caucasian people, but it really can affect anyone. It's usually diagnosed between the ages of 20 and 50, but can be diagnosed at other ages as well. So that's the most common way it's presenting. So if we can look at the symptoms and no symptoms, you can get treatment early and prevent some of the damage that can be done due to this disease. So know the symptoms and recognize them, prevent some of that damage that can be done from the inflammation. So inflammation is the main cause of disability and some of the symptoms. It's the damage is done to the myelin, which is the insulating layer along every single nerve fiber in our bodies. So that's where the damage is done, and that's caused by inflammation. So the treatment usually focuses on reducing that inflammation, and that is what can prevent some of that damage. So know the symptoms. Some symptoms include fatigue, numbness or tingling, depression, imbalance, being unsteady on your feet, blurred vision or double vision, weakness, poor coordination, pain, and trouble with your concentration or your memory. That's where the brain is involved. So think about some of those symptoms. If you notice some of those things, make sure you check with your doctor about that. Make sure there's nothing going on. And there's certainly a lot of these symptoms can be due to other causes and not due to MS, but it's good to get those things checked out. So the disease is unpredictable and it varies quite a bit. That's one of the things that makes the diagnosis difficult. The symptoms might go away and actually go into remission, so you might not have symptoms for quite a while, and then they might return and they might progress. So diagnosis is difficult, but in more recent times, they're using magnetic resonance imaging or MRI, and they also use analysis of the spinal fluid to help with the diagnosis. So those are two of the tools that they can use to help diagnose this disease. Remember though, if you know the symptoms and you get checked out early, you can prevent some of the damage that can be done. And the good thing is, the really fortunate thing is, that most people with MS, about 2/3 of the people with MS, don't get any kind of severe disability. They're still able to be mobile. They might need a cane or some other device to help with their balance, or they might need a scooter because they become fatigued quickly. But most people with MS, the majority of the people, are not severely disabled. So that's the fortunate thing about this disease. So for next time, we're going to be talking about strong hips and why that's important. We're specifically going to be focusing on hip abductors, which are those muscles that move the leg out to the side. So we'll talk about that and give a few exercises for those to strengthen those muscles. And with that being said, we're going to get moving. But if you haven't been exercising for a while and you feel like you're not in good shape, make sure you check with your healthcare provider before you start any kind of exercise program such as this one. And if we start moving and you're exercising and you feel some symptoms like chest pains, shortness of breath, dizziness, make sure you stop and get checked out. Make sure you're okay. That being said, let's get our bodies moving. We always start with a warm-up. That gets the muscles ready to get stronger and ready to move more intensely. So you start with a warm-up, taking nice deep breaths and getting the fluid circulating in the joints. So those are the two things we're doing during the warm-up, is circulating that fluid in our joints and also increasing the circulation in our muscles. So getting the blood flowing into the muscles so that they can get the oxygen that they need when we do the harder stuff. So we're just stepping side to side. And now we're going to change to a kick to the front. Kicking out, try not to use your whole body for the kick. If you isolate your leg and kick only with your leg, that means that you are using your core muscles to stabilize. And you're also using your hips. Hips are really important stabilizers for our balance. So we're kicking ahead. So far the arms are not moving, so let's get the arms involved. So we're loosening up the shoulder joints and breathing deep. Keep forgetting to mention we don't have any music here, but you can pick your own music to keep you company while you move and while you get your body moving. So pick your favorite music and that'll make your workout even more enjoyable. All right, we're kicking to the front, swinging the arms. Still relaxed. The warm-up you want to do in a relaxed way to get that blood flowing and get that fluid flowing into your joints, like lubricating a rusty hinge. Now the kick is going to go across. So when you go across, you're stretching the hips a little bit. So you're loosening up the hip joints more in a different direction. Hip joints are very complex. They can move in every single direction. They can rotate. They can go front, back, sideways. But if we're moving our hips side to side, we're also rotating around the spine. So now we're getting the fluid moving in our spine. And our spines are also very complex. Should be able to move in all different directions. But often you'll notice as people get older, they get stiffer and stiffer, can no longer turn or bend. And we got to work on that. So inch by inch, you can get that mobility back. Kicking side to side. All right, let's go back to side, and we'll add a reach. So really lengthening out. Now I'm feeling the shoulder, and I'm feeling the back loosen up some more. And I'm breathing a little deeper. So we can even loosen up the rib cage. Rib cage is attached to your spine, so that also has to be mobile in order to take a nice deep breath. Good job. Another thing that we think about as we get older, or we see other people getting older, they get slower and slower. We don't want to get slow. We want to stay fast and be able to move slowly and quickly, because sometimes it's necessary. All right, side to side with a reach. We're getting that synovial fluid moving in the shoulder joints and the elbow joints if I bend my knees a little bit, then I'm activating the quads. And let's reach forward. So a little bit different shoulder stretch, lengthening out the upper back muscles. Let's do a little punch. Good work. And you can decide how you're feeling today. If you're feeling good, you can pick up the pace. If you're feeling a little sluggish, you can go a little slower. But remember, your body will get more benefit if you challenge yourself a little bit. You get the best benefit if you increase the intensity a little bit. Punching to the front and reaching, and let's do a tap. Waking up the feet. We don't want our toe joints or our ankle joints to get old either, so we got to keep using them. Tap and reach. Good work. Lengthening the rib cage. And tapping the toes. So that wakes up the calf. All right, let's do a figure eight with the shoulder joint. So first we'll circle. 3 circles to the back. 3 circles to the front. And then a figure eight. That means a circle in one direction and the other direction. One direction and the other direction. This is one of my favorite moves because it's simple, but if you get bigger, it's a full body move. I'm using my shoulders, I'm using my elbow, I can even use my hand, but then it's also working the upper back. If I bend my knees, it's activating the quad muscles. And the more we're reaching down and reaching up and around, then the spine is involved. So rotating around the spine. Very nice. It should feel good. Should feel like it's loosening up. Let's go to the other side. So we'll circle 3 circles to the back and 3 circles to the front. And then go into a figure eight. So circle one direction and the other direction. One and the other. Getting bigger. And breathing deep. In through the nose, out through the mouth. In and out. Good job. Bigger and bigger. So you can see I'm bending my knees. So I'm activating those quads. When you bend your knees, you may not notice it, but you're also bending your ankles. So we're activating the calf muscle and stretching the Achilles a little bit. Bigger and bigger. All the way to the floor, if that's in your comfort zone. And circling to the back to get a little more rotation. Good work. All right, just checking my mic. Now let's do both arms. So elbows back and then forward. I'll show you from the side. So arching your back in one direction, pulling your shoulders back, using your elbows to pull your shoulders back, and then using your arms to pull your shoulders forward. So we should feel a really good stretch in that lower back, reaching in both directions, and then reach up and open the chest. Let's do that again. Elbows back and up, out to the side, rounding the back, pulling the hands forward. You can put them together, feeling that good stretch in their lower back and your shoulders, then reaching up and opening the chest. Fairly simple move, but if you do it correctly, you can really open up your chest and improve your posture. Okay, let's move on to the feet. So we're going to go up on the toes and then lower down, working the calves, working the feet, up on the toes and lower down. You need strong feet for a good stride when you're walking, so you can bound up the stairs and down the stairs. Good job. Up on the toes and down. Up on the toes and down. Couple more. Up on the toes and down. Now let's bend the knees, get a little stretch, and straighten and up, down, bend the knees, a little stretch, and push up and up on the toes. Good job. All right, let's go. One leg straight out in front, lifting the toes, so you're activating the front of the calf and lifting to the front. 3, 4, 5, everything else is stable, working the core. 7 and 8. Now let's go to the side. So activating these side hip muscles. Toe is still pointing up. We're going up for 8, 7, 6, 5, 4, 3, 2, and 1. Other leg, toes pointing up. We're activating this front of the shin, stretching out the back, and lifting up for 8, 7. We're not bending forward. We're keeping this stable, so we're using our abs to stabilize. 8, 7, 6, 5, 4, 3, 2, and 1. And then to the side, heels up off the ground and out to the side. It's a small movement, don't have to lift your foot very high. Knee is pointing to the front. You're not turning the foot out to the side. That's a whole different exercise. So 8, 7, 6, 5, 4, 3, 2, and 1. All right, let's change it up a little bit. So bend your knee and turn it out. We're working this inner thigh. It's a long muscle that's really important to stabilize the hip joint. So knee is bent, turned out, and lifting up. This might be a little awkward. It's not an area that we work very often, but very important. We'll go for 8, 7, 6, 5, 4, 3, 2, and 1. Definitely awkward on me, and I can feel it in my hip. Okay, other foot. Turn the knee out. Knee is bent and turned outward, lifting the whole leg. 4, 8, 7, 6, 5, 4, 3, 2, and 1. Good job. Shake out those hips, and we'll move on to the shoulders. So palms are facing away, and we'll push back for 8, 7, working the shoulder blades. 4, 3, 2, and 1. It's a small movement, but really powerful. Try to keep your shoulders from rising up. Keep them pressed down, and we'll go again. 8, 7, 6, 5, 4, 3, 2, and 1. Now let's go in and out, in and out, in and out, working the muscles in a different way. Keep going. Out, in, out. Now let's go diagonal, like that. In and out, in and out. Other side. In and out, in and out. Good work. All these are good posture muscles, opening up the chest. All right, back to hips. So you can grab a chair if you need it for balance. We're going to work the back of the hip. So let's do with a straight leg this time. Slide your toe back, knee is straight, and just lift a little bit. So knee is straight, lift and lift. It's might be difficult. A lot of people are tight in this front of the hip, this hip flexor. So it's not a small movement, but you should feel a really strong contraction in the back of your hip. For 8, 7, 6, 5, 4, 3, 2, and 1. If you can't straighten your leg, if you just can't do it, do the best you can, and inch by inch, cell by cell, it will get better. It'll lengthen out, and pretty soon you'll be able to straighten that knee. So other leg, straight knee, slide it back. You can have your toe pointed or flex, but knee is straight, and we're just lifting up a little bit to the back. Really a strong contraction in here, stretching the front of the hip. 4, 8, 7, 6, 5, 4, standing tall. Let's do 8 more. 7, 6, 5, 4, 3, 2, and 1. Good work. Something that I learned when we were talking about gait or stride, when you take a step, even though you're thinking you're moving forward, this other leg is actually moving back. So you really need to have some flexibility in that back leg in order to take a nice long step. If this is too tight, you're only going to take short little steps, and that's what happens to a lot of people as they get older. They take shorter and shorter steps because they get very tight in the hip joints. A lot of sitting causes tightness there, so we have to lengthen out the front of that hip. All right, now we're going to strengthen the quads with a little plie or squat. So knees are turned out. That activates the glutes, and we're going to go down for 3 and then up for 1. Down for 3 and up for 1. Down for 3 and up for 1. Down for 3. If you can't go this far down, you just go to your level and up. Knee is over your ankle. You don't want your knee to go over your toes. So if you have to do a wider base of support to keep that knee protected, that's just fine. Knees are turned out, knees over ankles. Down for 3 and up. Down for 3 and up. Now let's go down and stay down, and we're going to do some reaching. So reaching up and up, up, lengthening the spine and the shoulder joint. Now let's reach down. So we'll work at core here, work at spine, reaching down, and 4. Now let's reach behind. This is hard on your balance, but do your best. Reach behind and reach behind. Really working the core while we're working the legs. Now let's reach out and out, reach out and out. Come on up, shake out those legs, and we'll do a lunge. So pretty wide stance, bend one knee. You can lean on that knee and reach over to the side. As far as you can, you want to lengthen those muscles and then lift. If you lengthen, you're putting more space in the joint, and it can actually relieve pains that you might have. Lengthening muscles, lengthening joints helps relieve a lot of that pain caused by joints getting jammed up together. And up, reaching over as far as you can and pushing up. While we're reaching, we're loading up this quad. Then we're pushing up, we're loading the core, because we're looking for a long line from the fingers to the toes, and pushing up. 2 more, reach and up, reach and up. Let's do other side. So wide stance, bending the one leg, using this leg for support, reaching out as far as you can. If you're just doing this, you're not getting a whole lot of benefit. Really try to reach as far as you can and lengthen those muscles. Load them up. Lengthen and push up. keep it going. Good work. Lengthen. I can feel it working my balance reflexes as well. My ankle is wiggling. That's perfectly normal. Reach as far as you can and come up. Reach, lengthen, a little farther and up. Let's do 3 more and 2 more. Reach and 1 more. Good job. All right, let's do a little rotation of the hips. So knee is going to come up in the front and then turn out and in and down. Up and out, in and down. Really rotating that hip. You might not be able to go out as far as I am. Just go to your level. Remember, you have the power by your actions to change your body. You can do it inch by inch, cell by cell, loosening things up, lengthening the muscles and the joints, up and out, back and down. 1 more, up and out, back and down. Other side, lifting the knee. If you want to really work your balance, you can try to ease up the pressure on your chair, or you can try to go without the chair. That's a really big challenge. 1 step at a time. Maybe try just a little finger, just a little bit of support. Up and out, back and down. Up and out, back and down. Good work. Doing great. Up and out, back and down. We'll do some more balance work in a minute. Back and down. 1 more. Back and down. Good work. Balance work. All right, let's do step and lift, step and lift, step and lift. Try to pause and lift. Touch and lift, touch and lift. Step and lift, touch and lift. Really slow, really controlled. And up, touch and up. Now let's go forward and backward. Just 1 step and 1 step. If you have to put your foot down, that's fine. Gradually try to work up to where you're lifting and holding. So you're just balancing for 1 second on 1 foot. It's a very powerful exercise. Standing on 1 foot strengthens that hip joint and even increases the bone density. Really important as we get older to prevent osteoporosis. That's one thing they've actually done research on. Single leg stance or standing on 1 foot. I'm going to switch legs, stepping with the other foot. Standing on 1 foot for 3 minutes or 1 minute 3 times a day actually strengthens your hip joint, strengthens the bones, help prevent fractures if you do have a fall. Strong bones. Just shifting back and forward. All right, let's stretch out a little bit. I like to use a chair. So you can put your foot on the ground or up on a chair, turning your toe in and out to loosen up that hip joint. And then come forward, stretching the back leg. Come back, toe up, stretching the front leg, hamstring stretch. Forward for the front of the other leg. And backward, toe up, bending from the hip joint, chest is up. A lot of people do similar exercises, but if you're doing this, you're not getting a whole lot out of it. Chest is up. That's where you really get the stretch in the hamstring and the glutes. And then come forward, stretching this back leg in the front of the hip. Let's switch legs. So forward, stretching the hip joint in the front, that little hip flexor, the iliopsoas, and then coming back, toe up, chest up. Good job, we're almost there. Nice deep breaths. Come forward, front of the hip, and shift back, back of the thigh. You can move your toe up and down for a little more calf stretch. Nice work. And come up. Let's stretch the calf. So reaching your toe back, trying to press your heel into the ground. Knee is straight. Then you can shift back for the short calf muscle. You want to stretch both of those calf muscles to really mobilize your joints. If you only stretch one, you're not really getting the full benefit. So shifting back for the Achilles and the soleus muscle, shifting forward for the larger calf muscle, the gastroc. And other foot, toe goes back, pressing the heel down, lengthening out the back of your leg, lengthening out the large calf muscle, and then shifting back for the Achilles and the soleus, shifting forward. Good work. I can feel the whole leg being lengthened, even in the front. And shifting back. Good job. Let's do a little neck rotation, little circle to loosen up the neck. Don't want to forget about the neck. A lot of people, as we get older, the head comes forward, 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 and pretty soon we're collapsing. So shoulders back, chin back, and looking up, and tucking chin, stretching the back, and looking up, and rotate, and rotate, rotate, and rotate, rotate. Now it's loosening up. One more, rotate, and rotate. Let's take a big breath to release any tension that we got while we were moving, and blow it out. Deep breath. You made it through. Show yourself some gratitude. Good way to start the day. One more deep breath. And blow it out. Thank you for joining me. This is Barb with Active Aging and Therapy at Home. If you have any questions about the possibility of physical or occupational or speech therapy, you can check out our website at tahcares.com. Thanks for joining me. I'll see you next time. Bye-bye.